Reduced perfusion consequent upon congestive cardiac failure or CCF may trigger compensatory mechanisms that may lead on to intravascular volume expansion and aggravate the edema. In congestive cardiac failure, venous return is reduced with cardiac pooling and increased right atrial pressure. Reduced venous return then leads on to a reduced cardiac output. The reduced cardiac output leads to arterial underfilling and reduced effective circulating blood volume. A couple of things can happen consequent upon the reduced effective circulating blood volume. First, the volume and sympathetic baroreceptors in the aorta and carotids are activated, causing vasoconstriction to increase the blood pressure and maintain tissue perfusion. Baroreceptors can also mediate the release of antidiuretic hormone when there is a reduced effective circulating blood volume, which then causes intravascular volume expansion. The other compensatory event involves activation of the renin-angiotensin-aldosterone pathway. Reduced circulating blood volume can be sensed by the kidney due to the reduced renal perfusion, which then stimulates release of renin from the juxtaglomerular cells of the kidney. Renin converts circulating angiotensinogen, which is produced by the liver, to angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by angiotensin converting enzyme, or ACE for short, which is synthesized actually in the lungs. Angiotensin 2 stimulates the release of aldosterone from the adrenal cortex. Aldosterone is a mineralocorticoid steroid hormone that modulates activity directly and indirectly in the aldosterone-sensitive distal nephron, which includes the late distal convoluted tubules, the connecting tubules, and the collecting duct system. One of the main consequences of aldosterone is increased sodium reabsorption and water retention, which then leads to intravascular volume expansion. Angiotensin 2 is also a potent vasoconstrictor that increases blood pressure to maintain perfusion. Although these are compensatory mechanisms in the early stage to maintain blood pressure, circulating blood volume, and tissue perfusion, they may nevertheless contribute to increased intravascular hydrostatic pressure from volume expansion and aggravate the generalized edema seen in congestive cardiac failure and sometimes in chronic kidney disease.